I was curious. You said Hurricane Katrina,
Mhm.
and how did that happen? Because that's another interesting story. Maybe we jumped too far, but like I want to kind of like connect this back to the climate stuff.
At the time, I was director of mental health at the National Naval Medical Center in Bethesda. So I was doing some clinical work and a lot of administrative and leadership work. And everybody was supposed to have what they call contingency assignment. We have a disaster, a war, whatever. This is what you do. Um, Mine and a lot of other people's was to the USNS Comfort, which is the hospital ship that used to be docked in Baltimore. So I'd been out there once for my comfort orientation, but that's all I had seen of the ship. So when Hurricane Katrina hit, there was very strong desire in a lot of places to help, but um, but there was not a well thought out disaster response, at least in my opinion. And the hospital was tasked to send the comfort down to Mississippi. Um, um, we all got together and we went. The first the crew A lot of the crew went first to Jacksonville um, with the ship to get everything ready to go. The rest of us went by bus and met them in Jacksonville, and then went on to Mississippi, trying to figure out what in the world we were going to do. 'Cause we really didn't have the right equipment or staffing for a heavily civilian disaster relief mission, and we really hadn't been given the time, didn't have the time to really put that together. So we did some of that as we were on our way because the ship can steam 24 hours a day, but it goes, let's say nautical miles, about 30 knots at
Oh,
most. So it's not very fast.
yeah.
So it takes a while to get everywhere. So we get to Mississippi and are able to dock at an oil refinery because hospital ships are really big. Um, the Comfort used to be an oil tanker in its previous life, so it needs an awful lot of room. It also ideally needs a lot of things from the shore. Um, for one thing, you can't easily get patients on the ship. It was really designed, way back, with the idea that we were to fly everybody by helicopter onto the ship. That's not practical. I mean, it might be practical if you're fighting the Vietnam War again, but we're not. So all sorts of details like that had to be figured out. So we did a lot of our work actually on land in an old shopping mall that we had an area that we converted into a clinic and saw patients there. And we were just really starting to get things going well because there were lots of resource problems, political problems, all kinds of things when Hurricane Rita came along. And you really do not want something the size of an oil tanker in the harbor during a hurricane. Very bad idea. So we had to offload the few patients who were on the ship, get all the crew back on. When you have a hospital ship, the hospital ship is run by a civilian mariner crew. And then the military treatment facility folks are mostly Navy, although we actually had a civilian contingent from Project Hope on the ship with us.
Wow.
So get everybody on the ship. Unfortunately, the civilian mariners wanted us to go back around Florida where the weather would be okay. The military folks who decided where we were going to go didn't really understand hospital ships and sent us out with the amphibs. And we rocked and rolled and rocked and rolled. We almost came to the point of not coming back up.
Wow.
But fortunately, that didn't happen. And we didn't have any serious injuries, although one of my civilian social workers got chased around casually receiving by an errant Xerox machine. So it was, and we broke our anesthesia machine, we broke our CAT scanner, from all the rocking and rolling that we did. And then we couldn't get patients on the ship because there was no way to do it.
Right.
Eventually, that all settled out and we went to New Orleans. And New Orleans was surreal. At that point, everyone you saw was in uniform. Even the Salvation Army people and the Red Cross people were in
Yeah.
uniform. The population had pretty much been evacuated. We probably really should have gone back to Mississippi where there were actually people we could treat. But
Yeah.
we were kind of a very large political football. But just I managed to get on land and go out with the Navy sprint team, the special psychiatric rapid intervention team that was already there to
Yeah.
kind of see what was going on the ground. And you go to these houses, and there would be numbers painted on the walls. And the first set of numbers was how many people had died there, and bodies had been found. And the second had to do with the Humane Society folks that come up to do something similar for animals. And it's one of those things, once you see it, you don't unsee it.
Yeah. Wow. So I'm curious about like, wow, that is just like even having that visceral experience, that idea, as you're saying, like once you see it, you cannot unsee it. I'm curious about like how much of your work today, because one scary thought that I've had just by listening to you was the fact how not well prepared and equipped we are
Mhm,
to respond to this. And this is not to be in any way criticism of
mhm,
the effort that people were trying to do. It's just the enormous effect of something that we haven't seen before, how that can shock us, and how even like a structure like military that you would expect is somewhat ready to deal with uncertainty and novel situations, and there's a high level of training and discipline and all of that, still struggle to do. How much of that is was actually informing your work right now to say like, look, this is something we have to do. We cannot wait until
mhm.
these things start to happening to
Yeah,
start happening around us. Like, I'm just curious, like, because I had a, oh my goodness, like if that was the inside story, like I can only imagine if something bigger hit us and we have to
mhm,
deal with that, you know?
yeah. There's an old military adage that plans are useless, but planning is invaluable.
Yeah, yeah,
No way you're gonna make a disaster plan that things are gonna go the way you planned it, because disasters don't go the way that you planned it.
yeah,
They happen different times, different places, and all of that, but our biggest problem with Katrina, I think, was a lack of planning and expertise and lack of good leadership at various levels. I mean, I think most of the people that I worked with on the ship, um, you know, did a great job under difficult circumstances, although I would say a lot of what I learned about leadership I learned from Hurricane Katrina, and it was mostly what not to do or what I that didn't happen from some more senior people, who I think were trying very hard but weren't well prepared.
what would be an example of that? I'm just curious, like, you don't have to
Well,
have details, of course, but there's just, like, what would be one of the things that you would say, like, "Oh, I should never do that if I'm in that
w
position?"
one of the things I would not do is I wouldn't isolate from my people. That, the person who was in charge of the military treatment facility, the medical team, was an anesthesiologist. I don't know how used he was to talking to people who are actually awake. Um, but maybe he does fine under normal circumstances. And we were a large political football, and
Yeah.
he was getting conflicting information from different people. And his response to that was basically to hide from us.
Wow.
That we didn't see him for days. I mean, I was a Navy captain, same rank he was, and was responsible for one of the big parts of his facility or his medical treatment. And the way I met him was he almost knocked me over on a stairwell. And that morale just really, I think, tanked. I mean, I understand he was in a very difficult spot and didn't know what to say, but he wasn't willing to basically level with us, even with his senior officers, or maybe there were a few, to say basically, this is where we're at now. We don't know what's going to happen next. This is what we're considering. This is what we're planning. Um, you know, so we were all pretty much in the dark. At one point, I think the morale got so bad that this is the age of the internet and
Yeah,
everybody's emailing home. And this got up to Admiral Robinson, who was the commanding officer at Bethesda, where most of us were coming from. Um, and he flew down to come to the ship. And I watched him. He had been my boss at Health Affairs for a while. So I watched Adam kind of work the ship. And
that
he
sounds
talked to more people within maybe half an hour or an hour than our CO had talked to the entire time since we left Jacksonville.
wow.
Um, and that was, and
That's
it's
the
not
lesson in
well.
leadership, like, like, just talk to your people for God's
Yeah.
sake.
I mean, the only first time I heard our CO talk, there was this area up on the top deck, or almost the top, that is by the control area for the helicopters when they come in. So we're all standing at attention in the sun in Mississippi, in uniform and not very comfortable, while we hear um, the CO inside this thing way up there talking to us over some sort of a loudspeaker about things that had nothing to do with our mission. And I thought, I feel like I'm in the Wizard of Oz. There is the great Oz up there.
That is so it is like, well, thank you for sharing that because that is such an interesting, and you think about like how that sounds so basic, but it actually is so profound. Like when, and I could totally see, like, I'm not like this is not to judge, but like what is happening there is like you are trained to always have an answer. And once you're in a position where there is no answer, there and you don't like, we witnessed that during COVID as well, like where people were really struggling to go to the people and say, like, look, we don't have answers, but we can be alongside with you, and we're gonna try these things and that thing, and like that is also kind of like somewhat of accepting responsibility, like in a different way. And it's so hard. And you're absolutely right. In the disasters, the that is the baseline. You cannot assume that there will be anyone who actually have clear answers about how things will evolve or operate. Wow, I'm curious about, so yeah, we talked a little bit about that. And I want to pivot a little bit to another part of your career that I find really interesting, and that is the journey into integrative medicine.
Mhm.
Which again, it's a interesting detour or shift or pivot, or maybe not. I'm trying to also kind of connect the dots here. So, how did that happen? Like, was that after the Katrina, or was it influenced in any way by that experience, or it was different?
I think it kind of happened over time that, um, a lot of my work with patients and also with teaching residents was in consultation liaison, where you're looking at both mental, physical, and also social aspects of what's happening in someone's life. So certainly putting, those pieces together. And sometime sometime after September 11th, I can't remember exactly how much later, um, I sort of got interested in doing more with meditation. I'd never been a very good meditator in the sense that wasn't very regular about it. And I was at the American Psychiatric Association annual meeting and went to a talk about that. Thought, well, that sounds really interesting. And I tried out various things. I went to the Art of Living course, thought that was interesting, but probably not the direction I wanted to go in. Did mindfulness based stress reduction, a teacher training at the University of Maryland, and also a little bit and some work with John Kabat-Zinn. And I thought, okay, that might be more of the direction I want to go in, but didn't have a really good way to apply it right at the time. It didn't really fit into the work I was doing because the timing just wasn't really working. Became familiar with the Center for Mind Body Medicine, went to one of their continuing medical education courses on their program. And while I was there, I ran into one of my former residents, Bob Kaufman, who I hadn't seen since Katrina, and kind of reconnected with him. And I also started doing more work with the center, doing some teaching with them, and stayed in touch with Bob. And Bob had gotten the Navy to send him to a medical acupuncture course. So he
Hmm.
decided that I needed to go to the medical acupuncture course, and he talked me into it, and I talked my boss into it, who was a Marine, who was kind of like, "You really wanna do what?"
I feel like that's
But we managed to make that work. So
so. Can I ask you a question? I'm
Mhm.
curious about that because what was driving that? Like, so you're, so here you are, like you have a career like that was. I'm just curious, like, what have you seen on the ground among your people that was not enough, like with the modern Western medicine that you probably had access to in different shapes and forms and all the capacities that you were saying like something is missing out here. I'm just curious, like, what was your perspective at the time, if you.
I've seen a lot of people, with depression, a lot of people with PTSD, quite a bit of chronic pain, um, and there were things that we could do that were helpful with all those things, but, um, you know, for a lot of people, you do the best you can, you still haven't gotten where you wanna be or where they wanna be. Um,
Mm,
so just trying to look at, what else is going on, what else, can we do, um and how else can we kind of put these pieces together? And certainly the mind body medicine stuff was very helpful for that.
yeah.
I mean,
It's so fascinating, Francis, just because I think one of the things that I think is missing out in the current way we are practicing medicine is really what you're saying here is seeing humans as the whole versus seeing them as the piece of like residency or specialization that we have, and saying like, oh, you're. I almost like there's this saying like of kind of like we need to stop treating organs, we need to start treating people.
but I think it was kind of an outgrowth of the kind of work that I was doing, especially on the consult service because, you go from patient to patient, and for one patient, I'm basically being a medical detective trying to figure out why they're delirious. It's really kind of sad that sometimes the psychiatrist has to be the one that points out the patient just had a stroke or that their electrolytes are totally screwed. And then the next patient, the big problem is that they can't communicate with their doctor because their surgeon just doesn't get it, or they're having problems. The nursing staff is having problems with them and they're having problems with the nurses. So as you see all these people, they're psychological and social and biological things all going on. And you have to try to the degree that you can, put all those pieces together and figure out how all that works. So I think, bringing more of the mind body techniques into that, certainly was a natural outgrowth of that. I probably wouldn't have thought of the acupuncture if Bob hadn't persuaded me into it. But that was very helpful because, I mean, we were using it both for the obvious things like for pain, but there are also some excellent acupuncture protocols for PTSD and depression.
Yeah, that's really interesting. So to kind of connect the dots here, and speaking of connecting different pieces, so you have this career that kind of like started with on you had a one trajectory that then shifted by a leaf. It seems like there was a leaflet and obviously a really influential nurse that convinced you to, and probably Vermont winter, that you went on the path of Navy. You within Navy you had like more than just an experience as a doctor, but like also like doing some of the patient safety initiatives when that was not trendy nor something that people were jumping on, and then like the Hurricane Katrina experience, and then this experience in integrative medicine. How would you connect the dots all together with what you're doing right now? Like where, if you need to kind of like connect the pieces of the story here, what would you say? Like, especially in the context of the climate and climate and health and the work that you're doing right now, and also your coaching practice as well that you're trying to do.
I think, one thing that I noticed is that we were doing a lot of really good work with people on the individual level. And before I retired from the Navy and went into a civil service job at the National Intrepid Center of Excellence in Bethesda, and working in that program, which had a lot of very integrative things involved in it. And we were doing really, um, I thought, really good work for the patients. Patients were very happy with it. The commands that we're sending them, the doctors who were sending them were generally very, very pleased with it. It was really good work. But there are a lot of things that you can't really touch that way that are really important. And I kind of felt like I went to the NICO thinking originally I would do it for a few months because I was still on active duty. And I retired from the Navy and took a civilian job. I would do this for a year or two. I did it for about 6 years and got to a point where I thought, okay, I've probably done what I can do here. Things are changing. We were a startup. It's like people talk about in business that the founders are not necessarily the people who are going to do well with that for many, many years after that, but things change and that it was time to do something else. And I was interested in doing something um, that not that I wanted to stop dealing with individual people. That was kind of part of the interest in coaching, but that also I knew there were a lot of environmental and social forces going on in people's health that you really couldn't touch very directly in the clinic, and that it was maybe a good time to shift gears and do something for the most part different. I was a Red Cross volunteer until COVID, and then my clinic shut down. Um,
Mm.
because of COVID, and I'm still a volunteer for the Maryland Department of Health, but, you know, for the most part, doing more advocacy work.
Yeah. So what would be based on your experience and wisdom, and Francis, thank you so much for sharing that journey, which is I know there's many more details that we haven't even talked about. Like I know we didn't touch about your Age of the AIDS work, which I think like was also interesting when you and I talked about. But I'm curious about what would be what would be the message that you would share with people who are doing advocacy work, both in climate and health, and kind of like beyond that, like clinicians nowadays, especially younger generation, what would you say to them as a message to think about and why they should be even doing this type of work from the very beginning, not waiting too much?
I think, we're at a time with a tremendous need for that. There probably never has been a time there wasn't a need, but the needs are much more acute right now
Mm.
been in the past. And different people will focus on different parts of the work that, you know, as important as climate is, there's still other important things. But to find something that you care deeply about and to
Mm.
find other people to work with who also care deeply, but maybe bring different things to it than you bring to it, and to learn from them, and maybe they'll also learn from you, and also have some fun with it. People can get very grim, and that doesn't really help.
Yeah, I love that. Well, what a beautiful message for us to end this conversation. Francis, thank you so much. This was fascinating to listen and witness, and I had so many more questions, but like we have a limited time. But like I hope this will be also an invitation for us to continue these conversations in the community and go deeper on some of the lessons learned and wisdom that you bring into our work. So thank you, Francis. Thank you so much.
Well, thank you.